Hi, good morning, everyone. I think we'll just wait for some of the other panelists to come on. Thank you for joining us today for the NUS eOpen webinar, Ask a Nurse. Okay. All right, I think we can start proper. Good morning, everyone. Welcome to the NUS Nursing eOpen House webinar, Ask a Nurse. My name is Hadisa Joanne, and I'm currently a first-year PhD student in NUS Nursing, and I will be moderating our session today. Joining me, we have a tremendous panel of nursing leaders who also happen to be our NUS Nursing alumni, having graduated from our undergraduate program and some from our master's and PhD program as well. Let me briefly introduce them. We have Pamela Fung, a nurse manager from Khoo Teck Puat Hospital, advanced practice nurse Lim Chiching from the National University Hospital, nurse educator Muhammad Khairuddin and staff nurse Shahida Suhaimi from Tan Tock Seng Hospital, and Dr. Betsy Sia, a research fellow from the NUS Nursing faculty. Alumni, thank you all so much for your time today. I appreciate you all being here with us for this webinar. So the goal for the next hour is for us to have a discussion on the current nursing roles that support our Singapore's healthcare system, how this has shifted amid the COVID-19 pandemic, and how nursing as a profession has responded to our nation's needs, and to get a feel from our panelists on their views on the future of our nursing landscape here in Singapore. And here's a breakdown of how the next hour is going to go. I will say a few things in just a minute, just to kick off some discussion, and then hand over the time to our panelists. And what I'd like from our participants is to kindly keep their questions till the end of the session. We have a Q&A button where you can post your questions, and we'll have about 10 to 15 minutes at the end of our session to hopefully answer all your questions. But given our limited 1 hour time slot, I would just like to suggest, please reserve your questions related to admission requirements and program details to the end of this webinar. And I think there will be a link provided at the end of our discussion where you can click on it to join our breakout room thereafter. So please join us for that if you'd like to know more about our NUS program. All right, so to start this proper, I'd like to throw in some thoughts on our current workforce issue that has been a hot topic lately in Singapore. And I believe a lot of the participants who've joined us today and who have come to our discussion have asked this question. And that is, what are the prospects of a career in nursing, and in what capacity can our future nurses serve the healthcare system? So with these thoughts out there, I'd like to invite our first speaker, Ms. Lim Chiching. Chiching graduated from NUS Nursing in 2010 and has been an advanced practice nurse from 2016, having completed our Master's of Science program here at NUS. She currently works at the National University Cancer Institute of Singapore at the National University Hospital and leads the myeloma clinic and the telehealth clinic for patients with myeloproliferative disorders, both of which are for patients with cancer. So Chiching, thank you so much for joining us today. Do tell us, how did you figure out you wanted to be an advanced practice nurse, and especially in the area of cancer care? Chiching?
Thanks, Joanne, for the kind introduction. And this question is an important question, especially for those who have just started. And I would like to break down the question into two parts. Firstly, why do I want to be a cancer nurse? And secondly, why do I want to be an advanced practice nurse? I was first posted to an oncology ward during my first hospital posting. And it was not easy. And my buddy and I had encountered the death of an elderly patient during the first week of the posting. But it was also that experience that etched in me the desire to be an oncology nurse. The patient who passed away was an elderly granny with a stage 4 incurable cancer. She was in a lot of pain, and that could explain why she was angry towards us as well as towards his elderly husband of many decades. One night, the granny went into terminal delirium, which is the terminal stage of dying. She got really confused, and subsequently she passed away on that early morning. We performed the last office for her, and we tried to reach out to the granny's family, but to no avail. Granny's body had to be transferred to a mortuary after a certain hours in the ward. Shortly after, we managed to reach out to the family, and her husband turned up in the ward. Seeing him limping his way towards the empty bed the granny used to occupy just broke our hearts, and we just couldn't stop crying. Our preceptor allowed us to accompany the old grandpa to the mortuary. The process of walking him down and being there with him left a deep, lasting memory in me. He thanked us for taking care of his deceased wife during her stay at NC's, and for putting up with her, her short temperament, and ensure that she was comfortable during her last phase of life. These are my reflections over the course of my oncology career. First, cancer is the diagnosis of one person, but it affects many people that form part of the family nucleus. As an oncology nurse, support and care towards a family member is also an integral part in our cancer patient journey. Secondly, although we aim to cure our patients, but to our best ability, many times it's not an option. Symptom control and making our patients comfortable is the core of cancer nursing, and is one of our purpose. As a cancer nurse, we have to have good assessment skills and pay attention to patients' symptoms to help alleviate their suffering. There is a higher level of autonomy, as our doctors will need us to report and observe the patient symptom accurately to allow them to titrate medications to aid patient coping and relieve their suffering. With it comes a mastery, as cancer nurses have to always improve and seek help to speak up for our patients. The third thing that struck me was how short our lives can be, and how we need to ask ourselves what are the important things in life. My patients have taught me much more than what I could offer to them. Now I will move on to answer why do I want to be an advanced practice nurse. According to Singapore Nursing Board, an advanced practice nurse, in short APN, is a registered nurse who has acquired the expert knowledge base, complex decision-making skills, and clinical competencies for extended practice. They are trained in the diagnosis and management of common medical conditions, and including chronic illnesses. When I was that young, I was like, wow, this role is very fascinating. During my year 3 posting, there was a module on clinical shadowing. At that point, I requested to shadow an advanced practice nurse from cancer department to know what she does exactly. I observed how she used her sound clinical acumen and leadership skills to speak up for patients, suggest appropriate treatments, and negotiate for specific interventions to be rendered to our patients. I saw how she negotiated with the physicians as well as the nurses to improve care for our patients. I also saw how she could pick up recurring clinical issues and use evidence-based approach to improve work processes and patient outcomes. After that posting, I was sold. Yeah, Joanne, back to you. I hope I answered the question well.
Yes, thanks so much, Chiching. Thanks for sharing about your experiences and how you decided to be an advanced practice nurse, and through your experience in cancer care as well. So just want to find out from you, how is this role of an advanced practice nurse different from that of a staff nurse? And what characteristics, in your opinion, are needed for the role of an advanced practice nurse in today's healthcare setting?
Thank you for the question. As shared earlier, advanced practice nurse is on top at base. The advanced practice nurse is a registered nurse who has acquired the expert knowledge base and the complex decision making to allow them for that to perform the extended practice. One must first be a registered nurse with very good clinical foundation and is keen for the expanded role. It is satisfying, but it can be pretty challenging, as the role is highly complex and demanding. Advanced practice nurse is a role that is also constantly evolving. It requires a lot of resilience and adaptability to stay afloat among the changes in the job environment. Our roles have to support the peaks of excellence in patient care in general, as well as to constantly evolve to meet the needs of our patients. We focus patients. For my role, I focus my care in patients with multiple myeloma, which is essentially an incurable hematological malignancy. I have to provide independent patient review and need to titrate patients' medications, which includes immunotherapy and chemotherapy, through clinical and work reviews. One has to be trained in depth in mastery to be competent and safe. Myeloma treatment is also constantly evolving. A lot of research has been conducted in how we improve patient outcomes by improving the treatments we render to patients. As such, advanced practice nursing has to constantly keep up with the new development in treatments. On top of the depth, which is the mastery and the autonomy, we also need to keep abreast with the breadth of clinical practice. Our population is aging, and we have to be well tuned in the general medical practice to ensure we provide holistic and well-rounded patient care. The 2 years of Master of Nursing and 1 year of internship that an RN attends as part of the requirements for advanced practice nursing licensure is a very intensive course, and it provides us it's supposed to prepare us for the breadth of the practice. We also manage and titrate medications to better manage patients' cardiovascular risk factors. So your knowledge in diabetes and hypertension has to be taught, has to keep up with the evidence. It will cut down the numbers of trips that the patients have to make to the hospitals, and for the medical follow-ups. Some of us have also attended the National Collaborative Prescribing Program, and we are to facilitate our roles as non-medical prescribers. Yep. Back to you, Joanne.
Thanks so much, Chiching. And I think the nursing role really is expanding nowadays. And besides delivering excellent clinical care, nurses also take on managerial roles in the hospital to ensure the smooth operations of the ward and to maintain standards in patient care. And to tell us more about this role, we'll hear from Pamela next. Pamela graduated from our NUS Nursing undergraduate program in 2011 and is currently a nurse manager at Khoo Hospital. So Pamela, tell us more about your roles and responsibilities as a nurse manager, and how is this different from a clinical role like an advanced practice nurse like Chiching?
Yeah, sure. Hi. Yeah, so I'm Pamela. I'm a nurse manager in the intensive care unit at Khoo Hospital. So here we admit and we see patients who have 50% chance of living and dying. These patients are in critical conditions, and they require the use of highly potent drugs and machines to take over, the normal functions of a person. Yes, I've been a nurse for 10 years, and I have cared for patients with surgical cardiology, as well as general medical health issues. And unlike Chiching, who is an APN nurse who has an intuitive understanding of the patients with cancer, possessing a very in-depth clinical knowledge of, certain patient types, and then delivering a very personalized care and approach, to the patients. My role as a nurse manager is actually quite different. On a daily basis, yes, as mentioned, I ensure, the smooth operations of the ward, and they are broadly categorized into department matters, staff matters, as well as patient and clinical matters. And in order for me to carry out my role well, I will need to have a good understanding of the scope of duty of nurses, their interpersonal relations amongst other healthcare professionals, as well as reviewing processes and policies in place constantly to safeguard this practice. Some of the challenges I face are probably handling disputes and grievances. At times it's counseling bad behavior, and most of it's probably empathizing in someone else's situation. As the entire ward is under my charge, some of my responsibilities include reviewing statistics on admissions and discharges, budgeting for, the financial year, stock take, of supplies, like wound products and even medical equipment. And in spite of all of my administrative responsibilities, I do retain the clinical aspects of the role as a nurse. On a shift, on a daily basis, before I embark on clearing these administrative duties, I conduct nursing rounds. I have to check on the standards of care. I still have to interact and talk to patients and relatives to have a good sense of the climate of the ward and what's happening. However, I do not do this alone. My counterpart is probably a nurse clinician. And this nurse clinician who plays, this primary role of maintaining the standards of care, the clinical competence of a nurse, and, looking into the latest updates of the standards in research to assist us in overseeing the ward. Yeah, so what I enjoy most about being the nurse manager is that I play a very cross-functional role. Besides handling the situations in the ward, I do have to work with persons externally, such as other nurse managers, clinicians, doctors, pharmacists, etc. I also take part in various work groups and teams to look into hospital-wide matters such as medication error and safety. So part of what I do is about delivering, the vision as well as the direction of the hospital from my bosses like the chief nurse, other HODs to nurses under my charge. Yeah, and mostly it's about making them understand the bigger picture. Yeah, so I hope I answered the question.
Yes, you did, Pamela. Thank you so much for your sharing. I like the part where you brought out about cross-functionality. And I think that goes across the board to all nursing roles, because you never really lose your role in all the different areas, like in your clinical role, in your management role, be it in research or in education. It's always a marrying of the roles, and there's always some form of teamwork that needs to be done with all the different roles in nursing. So thank you so much for your sharing. And I think right now we've heard perspectives from both Chiching and Pamela on the clinical and the management role that nursing does play in our healthcare system today. But if you feel that, maybe for you, clinical nursing or management roles are really not for you, and if you'd like to contribute and give back to your profession by training the future nurses, then maybe the educator track could be for you. And to help us understand this role a little bit better, we have got Kai with us. Kai graduated from our undergraduate program in 2012 and is currently a nurse educator in Tan Tock Seng Hospital. So briefly, Kai's role as a nurse educator involves looking at clinical competencies, staff education and development, and career path and role design. So Kai, thank you for joining us today. Could you tell us more about this nurse educator role? Like, what do you do on a day-to-day basis?
Okay, thank you, Joanne. Welcome to the open house. Thank you for joining us. My name is Kai Rudin. You can call me Kai. I've been a nurse for about 8.5 years as of now. Been to a couple of areas before being honored to join the nurse education department. As for the nursing education department, right, we need to understand the trends of population healthcare, and then we'll be tasked to look at our workforce and see whether we are equipped or ready for the battles ahead. So from there, we plan. It involves a lot of planning, definitely. Delivery methods involved in looking at content delivery and how you package it into our institutional needs, and also that it should be short, succinct, and bite-sized. Career development is actually one of the things that we look at, looking at ways of how we upskill our population, empowering our manpower per se, also answering queries of our population, nursing population, on how they progress as they grow up, they are into their roles, and what are the options that they have in related to our current resources in the institution per se. Assessment tools, looking at all the metric tools to ensure that new or updated materials are classified high risk, medium risk, or low risk, so that we can pitch it to the masses on how we plan with the resources that we have at bay. Example, during the COVID period, my senior nurse educators was tasked to come up with teaching guides with the nurse specialist inputs to ramp up manpowers, to train them to ensure that they are equipped when they're actually opening up new wards to manage the sudden surge. Getting first up information definitely helps, so that we can plan and as a team to ensure that our mass nurses get the necessary trainings, which is very important. And these things actually keep us on our toes so that we can adapt and see what the current needs and patch up the gaps so that we can move as a country. Thank you, Joanne.
Thank you so much, Kai. That was a fantastic summary of your role as a nurse educator and what you do on a day-to-day. So thank you for that. And to summarize what we've heard so far, So if you see yourself joining clinical nursing, you could pursue a career as an advanced practice nurse with specialized training. If you prefer the management role, managing your staff and the ward, then you could consider a nurse manager role. But if you are interested in teaching and training the future nurses in the clinical setting, then maybe the nurse educator role could also be perfect for you. However, if you have brilliant ideas and have a knack for generating new knowledge, then perhaps research could be an area that you'd like to explore. And to help us understand nursing research a little bit better, we have Dr. Betsy Sia with us. Betsy completed her undergraduate program in 2012 and subsequently returned back to us in NUS Nursing to pursue her PhD in nursing in 2015 and is now a research fellow in NUS Nursing. So Dr. Betsy, thank you so much for joining us today. Could you tell us a little bit more about your decision to move from the clinical setting and to pursue a career in nursing research?
Yeah, thank you, Joanne. Okay, so my interest for research was sparked during my undergraduate nursing program when I took on the 4th year honors year. And this honors year program allows us to actually embark on a research project. So for myself, together with my friends from medicine as well as pharmacy, we organized a health screening for at Chinatown for elderly, and I collected research data for more than 200 over older adults that are related to data related to quality of life outcomes and things like that. So that experience had given me an insight to what nursing research is all about. So back in school, what we do is to do a research project, we learned how to write a research proposal. We learned how to do a thorough literature search, how to apply for research ethics application, coordinate manpower, collect data, how to analyze them, as well as generate a final research report to disseminate findings. So through this entire experience during my honors year program, it made me realize that research is about identifying clinical as well as healthcare gaps. It is about generating knowledge to understand these gaps and coming up with new ideas to address them. So it is through all this experience that I learned that knowledge is power, and power drives changes. I know that sounds cheesy, but it is really the case. Yeah. So after graduation, like what Joanne has shared, actually I went to Tan Tock Seng Hospital and worked at the emergency department for 3 years. And although I love the fast-paced environment and adrenaline rush during the clinical emergencies, I really want to learn more about research methods and the skill sets to pursue my interest in research. So I left clinical work and I took up the 4-year PhD NUS nursing program, PhD nursing program that was full-time in 2015 to develop my research inquiry skills as well as knowledge. So the PhD program is actually different from the honors year because it allows you to be exposed to more different types of research methodologies to design and conduct a rigorous research project that you're highly passionate about. So you tend to delve deep into a particular area and you specialize in that field itself.
Yeah, that's nice. Thank you so much, Betsy, for sharing your decision to move into the research area. And now that you are a research fellow in our university, could you just share with us, with our participants today, what your roles and responsibilities are as a research fellow based in a university?
Okay, so being a research fellow at NUS Nursing meant that you get to embark on a research project of your interest, something that you are really highly passionate about. So being an amateur, so although I have a PhD, we are still considered as an amateur researcher. And each of us are being assigned as a mentor who can help and guide us in developing our career as academia. So the job scope of a research fellow include working with people from healthcare institutes, including hospitals, community partners, as well as other international collaborators to develop and conduct research projects. It also includes like writing, reporting of manuscripts, having to publish in journals to share our research findings, and at the same time, we are also involved in doing some undergrad teaching for the students. So to the prospective students out there, I may see some of you too. Yeah. So, and as a researcher, we are being trained to do extensive literature search, to data analysis. We meet people from different disciplines, all walks of life, and we share our research ideas. And it is through that sharing that we generate new ones. And for myself, my research interest is on health promotion of older adults. So I get to interact and talk to many of the older adults in the community. Yeah.
Nice. Thank you, Betsy. You mentioned earlier on about teaming up with partners from different healthcare institutes. And I believe this really sums up the informative and collaborative role of a research fellow, where findings from nursing research can, at the macro level, inform public healthcare policies and systems, and then at the micro level, inform decisions that clinicians and managers like Chiching and Pamela, and even educators like Kai, make in their practice in the wards and in their respective hospitals. Yep.
Yeah, that's right, Joanne. And I want to add something. Being a research fellow, you also get to attend international conferences. So back during pre-COVID times, you get to actually travel to different parts of the world to attend international conferences, learn from like-minded people about your research area and enjoy. So that is actually one of the perks of being in the research track. Yeah.
Yes, thank you so much for your sharing, Betsy. And yes, I think we can all agree with you that traveling out of Singapore again, be it for work or for leisure, is something that we all want. But amidst the COVID-19 pandemic, I believe one particular nurse traveled back to Singapore and answered our nation's call in the fight against the pandemic. So Shahida, thank you for joining us. Shahida graduated from our undergraduate program in 2012, but in 2016, she decided to pursue her passion for diving and was just beginning a course as a conservation instructor in Thailand when COVID-19 struck. And feeling compelled to lend a hand in this pandemic, Shahida returned back to Singapore and served in the community care facilities at the Singapore Expo, where she cared for the physical and the mental health of our foreign workers at the community care facilities. Shahida, thank you so much for joining us today again. It must have been such an experience to come back and serve on the front lines. Could you share with us, how did your background and your nursing degree really help you in this experience? And what were your main takeaways from your time at the community care facilities?
Okay, hi everyone, I'm Shahida. And similar to Betsy, I am in Tan Tock Seng Hospital right now and working in the emergency department. So to answer your question, okay, so I'm not like, I don't have a really nice title like APN, NM, and EN Research Fellow. I'm still a staff nurse there. So I am still trying to get back into the rigors of nursing and find my way in this pool of talent. So how useful is it to have a nursing degree? Not only has it helped me come back from my time away into the nursing workforce as quickly as possible, it really has helped me while I am away. So as soon, fast track to where I am, where I was about 6 months ago, because the COVID happened, right? I came home. I started working, I think within a short, after I finished my stay home notice, within like 2 weeks, I got to work in the community care facility in Expo. So that was 2 weeks of my application and I got it already. So that's how fast having a nursing background gives you a job if you really need to. I was really proud of being part of the effort. I think it's really commendable for all of us nurses to be part of this pandemic, fighting this pandemic together. And I think that was what I felt when I first stepped into the Expo. So, like I said, they opened applications and within 2 weeks I got the job. So within that 2 weeks as well, you must imagine how fast everything was put together. So it wasn't just nurses that came together. It was the doctors that they had to find, logistics to set up the whole, the rooms. You've got the housekeepers to maintain cleanliness. You've got security to make sure no one, fight happens, whatever. But yeah, you can see how quickly everyone just came together, and throughout the process, because it was all really, really new, it was ever changing.
Yeah.
It changes within the shift. Things can change within the day, within the week, and you really have to adapt really quickly with whatever that's happening. So I enjoyed my time there. I think it wasn't just that being part of this effort. It was that you could see everyone wanted to play a part to fight this pandemic. So yeah, I had a good time there. Really made good friends. I want you to think about this. So when pandemic struck, we all needed I came back, but it wasn't just me. There were a lot of people like myself who had pursued their own passion. We all kind of congregated in the expo together. So you met very, very interesting people who were also nurses. I want to say nurses that came back to help. So yeah, you meet really, really cool, fun people while I was there. Yeah.
Wonderful. Thank you so much for your sharing, Shahida. And I'd just like to highlight the part you mentioned on everyone and everything coming together. I believe that is truly important in a nationwide crisis like the COVID-19 pandemic that we had just gone through, and really is testament to the interdisciplinary nature of healthcare. And in NUS Nursing, we offer this IPE program. It's what we call the Interprofessional Education Program, where our student nurses engage with medical students, students from pharmacy, from social work, and even students from physiotherapy to learn effective communication, respect for persons, and to understand that while our disciplines might be fairly different, they cannot function independently after all. And our environment here at NUS, I believe, is perfect for this, as we are a comprehensive university with opportunities to integrate with all the other disciplines and all the other schools and faculties to truly prepare our nurses for the interconnectedness that is our healthcare system. And in that same thread, since we are talking about the COVID-19 pandemic, let's hear from our other panelists how their roles have sort of shifted during this pandemic and how they remained adaptive in this time. So we'll start with Pamela. Pamela, if you could just share with us how your role has sort of, how you've adapted as a nurse manager during the COVID-19 pandemic.
Yeah, during the COVID-19 pandemic, it was really gratifying to see, everyone coming together like what, Shahida mentioned. Yeah, so during that period of time, my role as a nurse manager is to oversee, the deployment of resources to areas with urgent needs, such as manpower, equipment, supplies. Because it was so uncertain, the situation was so uncertain, we really didn't know how long we'll be in it. Yeah, and it was really like a worldwide shortage. Everybody was scrambling to just ensure that we had everything, enough of everything. So personally, I had to, count the burn rate of mask use on a daily basis, to prioritize who exactly needs the resource. And during that period, it was even more important for us to work closely with key stakeholders, such as, the doctors, the clinicians, the pharmacists, operations managers, administrators, cleaners even, and our environmental associates, to just align our goals. And everyone's goal is basically just everyone's safety. A lot of our successes were dependent on the knowledge of each other's, roles and responsibilities. We really need to know each other's boundaries, where we can cover, what gray areas we had. Yeah, and we really needed, all the hands on the deck. Some of the things we did were to, hold off services which requires face-to-face communication. We even had to hold off, certain services such as, elective surgeries. So some surgeons were told to, hold off their surgeries, and they were deployed to COVID pandemic wards, to nurse general medicine patients, which is completely out of their scope of duty. Yeah, so we really had a lot of huge movements of staff, doctors and nurses to all these unfamiliar areas. And what we also really needed was concise training, and that's all a lot from our nurse educators. Yeah, and throughout this pandemic, what I learned most was that building the psychological resilience amongst all of ourselves, right, is important. It's just a will to overcome the entire pandemic. Yeah, and that's how my role has shifted. Yeah.
Yeah, thanks, Pamela, for sharing. And indeed, it was really a challenging time. And I'll probably share a bit on how cancer nursing service has been impacted, and how on my reflection, what advanced practice nurses has done in NCs have done to help chip in our fight towards this unprecedented time. So advanced practice nurse role has to keep up with the needs of our nation, especially during times like this. Cancer has become so common, and our national statistics show that 1 in 5 people will be diagnosed in cancer in their lifetime. And there is a growing pressure on healthcare to continue to provide top-notch cancer nursing service, even during the pandemic time. One important key area that we work on in providing patient-centered care is to provide care in the community where the patients live. This could reduce stigma towards cancer patients and also facilitate transition from the patient's sick roles earlier, since they receive care in the comfort of their home as well as in the community. To some of our patients coming to NUH with a big title, cancer center, always remind them that they are still cancer patients, no matter in what phase their treatment is. So as such, right, we have adopted the telehealth as a method of providing care to stable cancer patients even prior to COVID. In order to ensure safe practice, we have put in workflows and processes with the help of our ops and admins and physicians, and the information technology and data protection things in place. We also established collaboration with community healthcare providers such as polyclinics to facilitate blood tests in the community. During the unprecedented time of COVID, there was a huge strain on healthcare resources. Cancer care is also not spared. As what Pamela has shared, a lot of our manpower have to be channeled to fight the COVID as a nation. Some of them had to be redeployed to community care facilities where Shahida was, and some of them were also in NCID. There was a huge strain in healthcare resources, and we had to postpone many non-urgent patient appointments to cope with patient load. However, because the telehealth structure, many were in which APNs have played a big role in some of the services, the patient review could still continue as per normal, and many patients could still get their needed care using technology without even having to turn up in the hospital. Yeah. So I think there was also quite a bit of stress on how nursing education has been impacted. So now probably Kai, hear from you.
Yeah, let's hear from Kai. Kai, how did your role change during this COVID pandemic?
Okay, actually during the COVID pandemic, I was actually deployed to the screening center per se. So I've seen firsthand on how my colleagues actually have to tweak certain training methods, especially with COVID strict measures. As you can see that even schools has to close, but our training still have to go on. Yeah. So ramping up manpower means a lot of trainings to be done. As you actually shift people from other areas that we congregate, right? We need to ensure that their skills are actually up to date. So with the limited time and also with the COVID measures, we really have to stagger and open up a lot of slots, cut training shorts, and make sure that those information that are actually important at that point of moment, especially PPE competencies, mask fitting, accelerated training for nurses who's going to support the ICUs. And doing this, right, is actually sometimes it can happen overnight. Support documents have to come up and also be actually current and available, especially our trainings and even our supplies. Imagine our supplies are cut short around the world. So we have to adapt and source out from other countries and all. I think Pamela will be very interested to talk about that if, for example, she has to source out a lot of equipment from other areas. So with this COVID, right, instead of doing a lot of face-to-face, we have to do a lot of Zoom small breakout rooms. Like, for example, we are forced to learn how to use Zoom on our participant and understand that we have to use short quizzes, polls. This has to be learned like most probably overnight on our department. So it was actually a very interesting, always keep us on our toes, I can say. And understanding that adult learning pedagogy, we have to pitch it bite-sized so that they actually can understand and move. Because we cannot do a lot of rote learning. We need to understand that our learners are at this point where if you can pitch to them that these are important for you to take note, important for you to move, and will keep you safe and your patients safe. Yes, then you have done your part.
Yes.
So I was actually one of Kai's students, which is funny because we studied together. In October, I think I had my orientation under NUS Educator Kai, and it's true, because of the COVID pandemic, you could see that he and his team, they had to come up with ways to ensure safe distancing measures while still teaching everything that was necessary. So I remember, because I'm from Tan Tock Seng, all the Tan Tock Seng new nurses had to come to work, and we had the live person in front of us talking, but those nurses from Woodlands Health Campus, a new hospital coming up in 2022, I think, they had to learn through Zoom. So there was always issues during our sessions, because sometimes you couldn't hear us, blah, blah, blah. So I think Kai now is very good with Zoom sessions.
Hopefully.
Yeah, and I can totally like empathize together with Kai, because the transition to change to use of all these technologies is like so fast. So for myself, life does goes on in the university, and we continue to provide nursing education here. So like what Kai has shared, as well as like other institutions, we adopted the blended learning approaches, whereby lectures as well as the tutorials are conducted online, while our nursing skills lab classes, laboratory classes, are still conducted face-to-face. So to all the prospective students, nursing students out there, you will still come back to the campus to enjoy and use our simulation laboratory facilities for clinical learning. And at the same time, with the strong support of our industrial healthcare partners, we continue to send our students for clinical placements and to various places. So this includes like hospitals, community hospitals as well, nursing homes, polyclinics. So you get a taste of different clinical placements at different types of institutions in Singapore. So I'm sure like together with the panelists as well as other nurses around, nothing beats, they will definitely agree to what I was going to say next. So nothing beats learning by doing clinical procedures and gaining from clinical experiences. So we really value that clinical placement that we have here in NUS Nursing. And we encourage and support our students to receive vaccinations prior to their clinical placements as well.
Thank you so much, Betsy. Very nice to hear that. I think a lot of the issues that we faced in Singapore, like, shortage of masks, like of the masks, and, having to go online and stop face-to-face, all our nurses were actually on the forefront of that. So it's very encouraging to hear, and very encouraging to hear from all of you. Thank you all for your sharing on your challenges and your experiences working through the pandemic. And I believe surely with this restructuring of and the shifting of our roles that has taken place during the pandemic, I'm sure the nursing landscape and the role of everybody and the everyday nurse will sort of see some changes in the future. I'd like to hear from our panelists on what their views are regarding this evolving role. But given the time, we only have about 15 minutes left, so I think I'm going to give every panelist about just 1 minute to tell me what your views are on the future of the evolving nursing role and the evolving nursing landscape here in Singapore. So Chiching, let's start with you.
Thank you, Joanne. Nursing is the biggest workforce in healthcare. Although it's challenging, it will have a significant impact on our healthcare services as the nursing workforce continue to improve and take on higher level of critical functions that were once doctors worked. So sharing from my experience as a hematology advanced practice nurse, many of us could perform invasive procedures such as bone marrow aspiration and line insertion, which is a line inserted to the heart to allow patients to receive life-saving medications. So with advanced practice nurses being the first to push boundaries and practice at the top of our license, we improve timeliness to healthcare resources and services in a safe and efficient manner. Recently, there has also been a lot of discussions on how the role of nursing has evolved and how much more it has to change in the near future in order to keep up with our healthcare needs. Dr. Jeremy Lim, a medical practitioner and associate professor from the Sosui School of Public Health, recently shared about how nursing has to have the right motivation to steer towards greater heights beyond just the increasing in pay. I would strongly encourage the audience to Google for the article and dream big on how nursing will evolve really fast in the next few years. We need to have faith that nursing is evolving beyond just being doctor's handmaiden. It will change, it will continue to change with time.
Thanks so much, Chiching. All right, let's hear from Kai now. Kai, just under a minute. How do you think the nursing landscape is going to change in the future?
Okay, nursing landscape is going to be very interesting as we are trying to understand the trends that we are having towards the golden age. Technically, is the elderly population. So understanding this, that there's a lot of role redesign where you actually focus more on community. So if you have understood the setting of Singapore, they are building acute hospital beside community hospitals with polyclinics nearby to our areas. So with this, all acute hospitals, I'm sure that they have community supports. So a community nurse to actually go down and support their patients. So this is to ensure that patients actually get supported in the community so that they will not be accessing the inaccurate or inappropriate resources. Like for example, they have to go through a myriads of steps and stages where they can actually pick up a phone call and say, hey, I need help. Can you please support me? Yeah, that's the role of the community nurse. Yes, so it is actually, that's the next big thing out there. Yes, go back to you.
Thanks, Kai. All right, let's hear from Pamela next.
Yeah, I will also echo, the things that were mentioned previously by Chi-Ching and Kai. For me, I still feel that, nurses will still be able to retain, that caring spirit in their work, be it like the evolvement of our empowered, roles and, the advancement in care. It will be a very exciting phase for all of us as we, continue to break the traditional norms of a nurse. And there will also be, a place for everyone in nursing as we work towards, more flexible work arrangement for work-life balances. Yeah, that's all from me.
All right, fantastic, Pamela. All right, Betsy, just under a minute. How do you think the nursing landscape will change in the future, and how can our nurses adapt to that?
Okay, so I'll just answer this question from the nursing research perspective. So personally, I think there's a lot of potential and growth in the development of nursing research landscape in Singapore. Because the beauty of research is that you learn from past knowledge that has been generated. Whether this knowledge is from the literature or through the engagement of people around or your environment, and you apply this knowledge to develop innovations and strategies to address clinical problems and clinical healthcare gaps. So in fact, there is actually no limit in what you can explore. And you are always constantly working on gaps that you identify, or you try to make things work, drive innovations, come up with new processes or modify them to actually enhance work in the daily work of our nurses. So in fact, I just want to highlight the field of nursing is really very vast. The application of the nursing knowledge and skills, it is not just applied in public or private hospitals, as well as the community sectors, community-based senior activity centers, nursing homes, hospice, and things like that. So as well as we can also look at the nursing profession and health systems as a whole. So research itself can be applied across all these different aspects to drive evidence-based care practices.
Fantastic. Thanks so much, Betsy. All right, Shahida, let's end with you. Just in under a minute, how do you see the nursing landscape change and how can nurses adapt to that?
Okay, because I left for about 6 years, I could see a little bit of a difference from the time I started 8 years ago and now that I began. I believe this year there's going to be a really big change in the technology, especially, and how different hospitals integrate and speak to each other. So patients that visit one hospital can still be able to go to another one, and all the information goes with him. So I think this year they have a really big project coming up where they will be creating this whole system where they're going to talk to each other. I believe in the next few years, that's what's going to happen. Like, we are going to be constantly we have to integrate ourselves into this technology with nursing, and hopefully it's going to make our lives, our work as nurses much easier along the way. Yeah.
Fantastic. Thank you so much, Shahida. All right, I think we have about 8 to 10 minutes left for our Q&A. And there are some open questions that we have in the chat. I think we can address them. I'll get some of the alumni to share with us their answers. So I'm going to shoot some of the questions to the alumni. Please be prepared to answer them. All right, we've got one question here from a Yamuna Devi. I'm going to read the question, and I think I'm going to address this question to... Let me read it out first. Is it true there is always a shortage of nurses all over hospitals in Singapore? And furthering education due to hectic shift work is almost impossible due to longer shift works. All right, I think I'm going to address this question to two people. We'll get Pamela to answer first, and then we'll follow up with Kai, because I think both of these things are got to do with managing the shift works and also with education. So Pamela, let's start with you.
Yeah, thanks for the question, Yamuna. So what I believe is that actually, it seems like there's a lot of shortage of nurses. It's probably because nurses are needed in multiple areas, and because of our training, we are very our skills are very transferable. We are very adaptable. We have to, play this role, and we have to deliver care according to our population needs. So currently, based on our population needs, we really need, the service for, let's say, aging population, and that's where, manpower is needed. So hence, I believe this is where you come from. You probably see it this way. And the second part of your question is about furthering education. When I'm not sure if you are talking about, part-time studies, because you say that there's a hectic shift works, also with your studying. This can be discussed with, your supervisors. Whenever you are doing, part-time studies with your work, we probably will have to make certain arrangements in the wards such that you can, achieve your career goals as well as, your professional goals as a whole. So I hope I answered your question.
All right. Thanks, Pamela. Kai, let's hear from you.
Okay, Yamuna, thank you for the question. Okay, it's very interesting that as we grow older, we have certain aspirations that you want to actually fulfill. So perhaps like one of those aspirations is for you to get your master's, or for you to actually educate yourself, get a specialist diploma and all. Okay, we have a lot of programs with schools, and especially with our local schools, and also on top of that with our international schools. So as long as it works in your schedule, so you need to understand that what do you want. So if you want it you have to fit. Everybody has 24 hours. So if you can fit it within that 24 hours of scale and it makes you happy, why not? So like Pam says, that you need to discuss with your supervisor and all to actually discuss that maybe I need the part-time work. Maybe I can only work 3 days a week because I have 2 days that I need to go to school. So this can be discussed further with your direct supervisor. On our part, that we will always discuss, manage what are the existing programs that we have, so that you can pitch it to you. We can tell you that, hey, there is a better program out there. Hey, look at what you are looking at. Is it feasible? Or is it something that is extra? Or is it something that you want it to pursue in your own free time instead of using it as your work? So it is a very flexible, especially Singapore. We have a lot of different settings. We have this long distance learning. We have part-time. Like for me, for example, I'm going back to NIE to take my PGDHE in July, part-time. So it's really what you want. Yeah.
All right. Thanks so much, Kai. Thanks. All right, let's move on to the next question. We have about 5 minutes left. All right. Okay, we've got one question here. As APNs, I believe that not only is clinical skills expected, I believe there is an expectation in knowledge, skills through research as well. As such, are there APNs who eventually pursue PhDs, or are there different job scopes? All right, we'll keep this reply short, and I'd like to hear from Chiching, please.
Hi, Joanne. Thanks for the question.
Yep.
With regards to this question, I think first of all, because research is a spectrum, and while primary research is one area, but there are also areas that we utilize the mature evidence from the research that, for example, that Betsy and the research team has generated. So it's in terms of evidence-based utilization. So I think there are no doubt there are advanced practice nurses who have gone on to pursue PhDs and are currently some of the adjuncts for NUS. There are also some who utilize evidence in the mature evidence to help drive changes in clinical care. So I think that question, it depends on what is really the need and how we can address the clinical needs appropriately. Yeah.
All right. Thank you so much, Chiching. All right, we've got another question. We've got a few questions coming in, and I'll just direct them to our alumni. All right. Okay. Does work experience matter more than academic results? Right. So I'm just going to give this question to Kai. Kai, could you help to address this question? We've got this question from Yong Kang. Does work experience matter more than academic results?
Okay.
As a nurse educator.
Okay. Okay. Like when I was a student, right? Experience matters more. You always look up to those diploma holders that actually join us as NUS graduate. They always have very intuitive with their hands, and also their practical session will be a breeze where you actually envy them. Because I came from clinical instructor before I joined the nursing education department. I've taken students from NUS, different schools. So I believe that with sound, rational knowledge in terms of what you do, it really helps in what you are experiencing. So you can always be the person who actually learned from mirroring, but you do not know the rationale. In the long run, you will not progress. You can't get the link. You can't, how do I put it, is there's no added value. So with academic results, right, that means if you have a good foundation in theory and all, it will really help in understanding and add on value to what you are doing. That means you find meanings. So if you are doing just for the sake of doing it without understanding, that's where it no longer have meanings. So work experience does matters over academic result. Academic result complements your work experience.
Yes.
Because work experience can only do so much.
Yeah. Thanks, Kai. I just want to add on. Yeah, I mean, academic results, they're just after school. And then once you're done with that, it's all on the ground after that. So I think experience comes with time. And while the academic results and your clinical reasoning, you get some of it from school, some of the theory from school, but they can only be developed with time. So nobody expects you to come out flying. You definitely will need time. And I think the nurses on the ground do understand and do realize that as well. So while academic results are important, experience is obviously even more important and will come with time. All right. Another question we have, let's see. Would you be able to change tracks, such as going from an APN to a nurse educator? All right. Let's see. I will pass this question over to always the same alumni. I need to change around. Okay. Let me pass this question to Betsy, because Betsy did move from the clinical setting into research. So Betsy, just share with us a little bit about that. about this move that you made, and whether this is possible for other settings as well from your experience.
Well, thank you for the question. I think when it comes to changing of tracks, it really depends on what you really want. At the end of the day, after working for some number of years, you will tend to develop certain interests in various in a particular aspects, and that's where you actually make decisions on whether you like to move is it from clinicals to research to or from clinicals to education. And pertaining to the question on that was just posted by Pao Ying, whether is able to change tracks from APN to nurse educator. I think the role of an APN is the scope of it is very broad and vast, and definitely education do play a component in as well. So I think to really answer this question, it has got to do with exposure. So you got to expose to the different tracks, and you will need to find out what do you really want at the end of the day, and you pursue from there. So everyone actually have a different pace. Everyone follows a different timeline. Yeah.
All right. Thank you so much, Betsy, for that answer. All right. I think we're just going to give about 5 more minutes for the Q&As. So we've got another question coming in. Actually, a few questions. Let's see. Okay, from Brennan Ang. While being a nurse in the healthcare sector and witnessing the passing of a patient who was recently treated by you as the attending nurse, what are some of the lessons that can be extrapolated from such devastating experiences? All right, I think we will go to Chiching for this one. I think Chiching shared about this briefly in her sharing. So just a short one. Chiching.
Yep. Okay. So I think Brandon, thank you for the question. I think it is we in oncology, because some patients, when they were diagnosed, the stage of disease is already quite advanced, so death is inevitable. As we might see a little bit more, but during my sharing earlier, when I first encountered the experience, it was really it etched in me, as in how short our life is. And some patients we attend to could be quite young, maybe in their 30s. Then another thing is really how as a nurse, when we provide care to our patients, whoever who make up the family nucleus is also as affected. So while the patient go into end of life time and they eventually pass on, there's a lot of work that we still need to do with the family members. We sometimes grieve with them, and also hope as we talk with them and support them, they can go through the grieving process a little bit easier. So I think as a cancer nurse, the experience and the take-home message I got from all these experience is how a nurse role can actually transform the grieving process of our family members, as of their family members. Yeah.
All right, thank you so much, Chiching. All right, we've got just one last question. We've got another minute, and I'm going to give this question to Kai. It's from a Johan Mbang. Sorry if I didn't pronounce your name correctly. Let's say that I'm currently an existing working staff nurse. How will I know that I'm competent enough to eventually embark on the different specializations? Will it also be based on my performance in the ward? I think I'll let Pamela and Kai answer this question very quickly, maybe 30 seconds, each of you. Thank you.
I'll answer it first.
Yes,
Okay.
Pamela, go ahead.
You answer first.
So what happens is, Johan and Mark actually said that you're an existing working staff nurse. How would you know you are competent enough? Actually, competence is not just based on clinical competence. There's also certain traits and soft skills that you require. So as a supervisor, you're asking if I will actually base it on your performance of the ward. I would say that there's a small factor and a percentage of how you perform. Certain I think you've heard from all of us, each specialization requires a lot of skills, communication skills, leadership skills. Yeah, you have to be competent. You have to know your work. You have to also have to know to have the right attitude as well. You know, and how would you know which specialization is suited for you? You probably have to talk about it. You probably have to explore it. Probably have to take on certain roles and you know, try your hand, try and error, see if, you know, this is what you really like, you know, in the future. And that's how you will really know like if you are ready for a specialization, and if you are competent enough. It's a lot about, you know, reflective practice and about you know, your reflection on how you fare, you know, as a staff and how you can contribute.
Fantastic. Thanks, Pamela. All right, Kai, 30 seconds.
30 seconds. Okay. Make it short and sweet. Okay. Competency depends on how you understand whether you are ready for it. Okay. Whether you are ready for it, there's always a need to engage. Okay. Have a talk with your NCs or NM and tell them, can you give a feedback on how am I as a nurse? Okay, feedbacks are important, especially immediate feedbacks, because that's how you improve and how you move. So if you do not have feedbacks or you run away from feedbacks, how do you move? Okay, so these are things that you need to take note if you want to know whether you are ready to embark, because feedbacks not from you, from your colleagues, from even to the person who actually serve drinks. Because like Pam says, that you need to understand that whether you have collegiality, you have teamwork and all. So these are factors to actually tell you that, hey, I am ready to embark on the next section. And after that, you can sit down with your nurse educator and talk it out, like whether I am ready, knowledge-wise, aptitude and attitude. Yes.
All right, you emphasize attitude twice. All right, thank you guys so much, alumni. Thank you for your time on this Thursday afternoon. Apologies to the participants for whom we could not answer all of your questions. But if you are still very keen to get those answers, please do join us for the breakout session in the next hour. I believe the links for the breakout session will be in the chat box, and also will be displayed on the screen with the QR code. But I think if it's easier, you could just click the link. And not just that, after our breakout session from 11 to 12, we also have our eOpen House program, which will continue at 2 p.m. Join us on our Instagram for a hashtag Ask a Nurse Anything session with our fellow students at 2 p.m. And then at 3:30 p.m., follow them on a tour of our simulation labs here in NUS Nursing. And all these are going to be happening on our NUS Instagram account at NUS Nursing, at NUS_Nursing, sorry. So alumni, thank you so much for your time. Great sharing of your challenges and your experiences. Love to hear from you, and hopefully we can hear from you again in the future. So thank you for that. Will we have the links for the breakout rooms? Yes, we have the links for the breakout room. So for the participants, apologies, we could not answer all your questions, but if you still really have a burning desire for those questions to be answered, please do join us in the breakout rooms. Our very talented and experienced associate professors and senior lecturers will be around to answer all of your questions and also give you some advice on our program requirements and admissions. So yes, please do join us. When you are ready, you can click the link and you will be redirected to the breakout rooms. Thank you everyone so much for joining us today. Have a pleasant weekend ahead, and Ganbate, hope to see you soon around in NUS Nursing. Thank you everyone. Goodbye, thank you.